Hello and welcome back to Proactive New York. I'm Christine Corrado. With me right now is Nader Pourhassan, CEO at CytoDyn, and Dr. Bruce Patterson from IncelDX. Great to see you both.
Thank you.
Nader, it's been quite a busy week for you. It's been very hard for me to get a hold of you. You've been treating coronavirus patients in New York with leronlimab. What's the latest come from here? I know you've gotten back some test results.
So we had a person who is really, we call him a hero doctor in New York hospital who believed in this product and asked us to send the product. So he filed emergency IND, and we will share his name and his institution probably next week with everybody. But having said that, he injected 4 patients at the beginning, and we announced so far today 2 out of 7 patients extubated. That doesn't mean the other 5 did not do good. We're just saying that the results that we got so far in the first 4, because the last 3 we just inject them. So the 2 patients that extubated, one of them self-extubated, came back alert, and it was able to self-extubate. But then that was great, the first step, but we needed to get an analysis of what's happening with the cytokine storm. So Dr. Bruce Patterson worked with his whole team overnight, the 2 nights in a row, and we got the blood sample at day 0 and then day 3 of 4 patients. And he's going to talk about the results. But what happened was we were all in pins and needles the night before we got the cytokine storm data. And then he called all of us at midnight, says, guys, the cytokine storm is really strong. Obviously, FDA has really talked to us about filing a protocol for that. But I want to perhaps ask Dr. Patterson to please explain the data for the cytokine storm, which is very important. Dr. Patterson?
Sure. Thank you, Nader. What was very interesting about these patients is I call it immunologic chaos. Everybody's forgetting about the fact that the virus and viral infections and the immune system go hand in hand. And what I was struck by looking at these patients off therapy was the profound immunologic disturbances in these patients, including the so-called cytokine storm, which is an increase in these chemicals in the lung that eventually finds its way to plasma that are so elevated relative to normal patients and actually causing the tissue damage in the lung. After 3 days of leronlimab, what we saw was immunologic correction of this immune chaos. The cellular immune components of the blood restored to close to normal, and there was a large decrease in the cytokines that compose the cytokine storm, especially interleukin-6, which has been discussed, decreased significantly in these patients, over 70%. And other cytokines such as TNF-alpha that are also involved in doing the lung damage also decreased. So we were very impressed after only 3 days of leronlimab therapy.
So Dr. Patterson, in your professional opinion, could this potentially be a treatment for the coronavirus?
Absolutely. I mean, I think we've already shown data on 4 patients already that, and as Nader suggested, 2 of which have been extubated, that this can be a therapy, especially in the severe cases. And the safety profile of leronlimab, i.e. it being safe in over 900 HIV patients, allows it to be used in these critically ill patients who have renal problems, liver problems, on top of this immune chaos going on in their lungs, causing lung damage.
Now, turning back to you, Nader, what's kind of the latest on what the FDA is saying in terms of filing a protocol here?
Well, very quickly, over 840 patients with hardly any side effects, 0 serious adverse event related to the drug. All these studies that we did in the last 5 years is paying dividend because now we're able to take that data and say to FDA, here's our data. If we didn't have that, we couldn't be in the position we are with coronavirus. So the FDA had given us some modification to our phase 2 protocol. This is for early and moderate patients who are not severe. And then when perhaps the result of these patients were coming out, the FDA has told us that as of yesterday, that we would also like you to do another protocol that treats severe patients. Now, keep in mind, we treat these severe patients, and perhaps half of them extubate and don't need ventilator, perhaps, and get out of the ICU, let the ICU room empty. We believe we have a good chance, if the results pan out to be the same way with the rest of the patients that we will be injecting, that we could have approval. So we are hoping for that. Obviously, that FDA has to weigh in on that before anything. But the FDA giving us now 2 protocols to file. We're going to file a phase 2 and then perhaps a phase 2-3 for the severe population.
So how many more potential patients would you be injecting?
So far, as we said, 7 patients. The last 3 were just injected. So the result that we see is the first 4. What we're going to do is we're going to let everybody who wants to file emergency IND to file that and be able to inject patients that they think is severe for them. But then we will have a protocol submitted to FDA, hopefully Monday or Tuesday. Amarex does a beautiful job getting that done very quickly, and Dr. Patterson and other doctors have collaborated and put the protocol together. So we should be able to perhaps get that to the FDA. If we do, then we can immediately inject everybody. Some of the sites are telling us they could enroll for our first protocol within 1 to 2 weeks by themselves. So imagine the number of patients out there. Everybody wants to get to this kind of protocol. So we don't see that this is going to be a long enrollment. It'll be very, very quick enrollment.
That would be amazing, especially in New York City, where the situation is really dire at the moment. On a separate note, just talking about your BLA, your biologic license application, is that still on track for the end of the month?
Well, as you can see, the coronavirus, most of the places have shut down, but fortunately, it hasn't affected us that much for our BLA submission. So we are hoping to have the BLA submission within a few days from the time we said, which is end of this month. So, 5 to 10 days, I think we should be just good to go.
And any closing words from either of you kind of on the situation that's really fast paced right now?
Well, Dr. Patterson, please let us know what you think about this cytokine storm, because everybody at FDA and other places were asking about IL-6 being a big factor, and they were worried about that. Dr. Patterson, please, can you elaborate on that?
Yeah, there's IL-6 has been an important molecule for everyone to address as a solution to this disease, but there's a lot more to this disease than IL-6. Obviously, other cytokines are elevated that also do significant harm. And in addition, the immune defects and the immune chaos, as I call it, going on has to be corrected, or you'll lose your ability to fight off other infections. So you have to look at it more holistically than just looking at the effects on one marker like IL-6.
Well, really appreciate both of your time today. I know that you've been working tirelessly, but all for a great cause. So thank you both so much.
Thank you. Stay safe, everybody, please.